So I request now Dr. Bhagirath sir to introduce our next speaker.
Good morning. Next speaker is Dr. Kush Patel, who is a retinal surgeon and he is an ophthalmologist practicing at the Swasthya Diabetes Care, Ahmedabad. And he is going to enlighten us about the diabetic retinopathy, the myths versus facts. Over to Dr. Kush Patel.
Good morning, friends, respected chairperson, my senior colleagues, and my friends. Today, my topic of discussion is diabetic retinopathy, myths and facts. So, first of all, what is diabetic retinopathy? It is progressive dysfunction of retinal vasculature, which is caused by chronic hyperglycemia, which results in structural damage of neural retina and microvascular along with microvascular complications. What are the risk factors for developing diabetic retinopathy? So one of the most common and most important risk factor is duration of diabetes. Around 50% of diabetic patients develop diabetic retinopathy after 10 years of diabetes, and subsequently 70% and 90% develop diabetic retinopathy as the age with diabetes increases, 20 years and 30 years accordingly. The other most common risk factor for developing diabetic retinopathy is poor glycemic control or poor control of diabetes. Raised HbA1c levels, which is increased blood sugar levels, and which directly proportionates to increase the risk of proliferative disease of diabetic retinopathy. The other common risk factors are pregnancy, hypertension, and nephropathy. And other risk factors are hyperlipidemia, smoking, obesity, and anemia. So, what are the common myths which I am going to discuss as are follows? So, most common myth developing in the minds of people with diabetes is that when my sugar levels are under control, complications like diabetic retinopathy do not occur. But the fact is, diabetic retinopathy develop because of ill-managed blood sugar along with other factors like duration of diabetes, medical conditions like hypertension, anemia, abnormal cholesterol levels, smoking, pregnancy, alcohol, etc. So as I said earlier, the other risk factors apart from diabetes are also an important aspect for developing diabetic retinopathy. The second most common myth is that as my recent sugar levels are normal, there is no chance of any diabetic retinopathy. But the fact is, the complications like diabetic retinopathy arise when an individual has poorly managed blood sugar levels for much longer time, not for recent sugar levels. So, as the diabetes is a chronic disease, such as diabetic retinopathy is also a chronic illness. So the recent sugar levels plays a minor role as compared to major longer durations of diabetes. The other myth is that eyeglasses power checkups are not necessary for diabetic retinopathy. But the fact is that in order to have proper eye care in diabetic retinopathy, regular refraction is quite essential. The refractive power of the eyes also changes with the level of your glycemic control. So, as the wide glycemic fluctuations occur, the refractive power of the eye and lens also changes with it. The other myth is that diabetics with fine vision and no other symptoms do not need dilated retinal testing. But the fact is that the vision is usually not hampered until the macula, which is the most centered part, which is the most important part for the vision, is affected. Besides, there can be other pathologies in diabetic retinopathy within the peripheral retina which do require urgent treatment. I will show an image that shows that the central retina, which is the optic nerve and macula, is not as much affected. But as you can see, in the periphery, there is thick white fibrovascular proliferation, which is suggestive of tractional retinal detachment. So it requires urgent treatment. As you see in the same case, the central retina is absolutely or relatively normal, but the peripheral retina needs urgent treatment and urgent vitrectomy surgery. So the other common myth is that it is not possible or safe to stay active after the diagnosis of diabetic retinopathy. On the contrary, the fact is that there is absolutely no reason to believe in this unless proved otherwise, or staying physically active can help reduce your symptoms of diabetic retinopathy by keeping the blood sugar levels within normal limits. The other common myth is that as I am having sorry as I am having type 2 diabetes, type 2 diabetes suffer less microvascular complications than other diabetes. But the fact is that the type 2 diabetics are at more risk to develop total loss of vision. Therefore, it is must for you to have regular follow-up appointments with your retina specialist or ophthalmologist. The other myth, which is quite commonly seen, that I got my glasses checked recently, so there is no need to go for further detailed eye examination checkup. So the fact is the glass correction or subjective correction of a patient is a small part of total eye examination. Total eye examination includes checking for your eye pressure, checking of your angles of the eye, cornea, lens, pupillary response, and detailed fundus examinations. Many treatable conditions may not get due attention unless a thorough examination is done. So the next myth is that I have had laser. So these myth is quite common, and I have seen so much patients with this myth that patients who have done laser treatment for diabetic retinopathy subsequently says that my sugars are under control ever since the treatment had started. So I do not need to go back to my retina specialist. But the fact is that diabetic retinopathy is an ongoing condition, just like diabetes. While strict diabetes DM control is must, there is no guarantee that the disease will not progress. Therefore, it is always essential that the patient gets himself evaluated at regular intervals by retina specialist or detailed fundus examination by an ophthalmologist. So the another myth regarding the patients who have already been treated for diabetic retinopathy is that I have had 2 injections inside my eye, but there was no response. So the medicine given to me or the injection given to me is ineffective treatment. But the fact is that the condition inside the eye may be difficult to manage and may need more than 2 or 5 multiple injections may be required. Several studies have demonstrated that the injection improves the edema inside your eye, which improves the quality of vision and life. So, the studies have already established that the injections or treatment given for diabetic retinopathy are there for improving your quality of vision. And needless to say that some damage which is beyond the control cannot be repaired. The other myth is that diabetic retinopathy is not seen in juvenile diabetics. But the fact is that it is not it. The fact is that the juvenile diabetics are the ones who are having longer duration of diabetes And as we said earlier, it is the most important risk factor for developing diabetic retinopathy. Another myth is that I have been just diagnosed to be have diabetic, so I don't need retina checkup until few years, which is totally incorrect. In UKPDS study, it has shown that 35% of the patients are already having diabetic retinopathy at the time of diagnosis. Hence, I would again stress on the fact that you should have detailed eye examination at the time of the diagnosis and thereafter regularly. Then the another myth which the patient commonly has, that they are having cataract surgery, and after cataract surgery they come to us and says that as my cataract surgery has been done, it cures the diabetic retinopathy. But the fact is, the cataract surgery and the development of diabetic retinopathy are totally two different things. And in fact, if retinopathy is already severe, it can worsen after the cataract surgery. So it is must to have detailed fundus examination before cataract surgery also and after the cataract surgery, so that if the retinopathy has worsened, it can be treated as soon as possible. So to wrap up, sorry. So to wrap up, diabetic retinopathy is a major cause of visual impairment and blindness nowadays. Therefore, it becomes imperative that patients who have diabetes must be educated about this serious disease that eventually lead to complete loss of vision unless treated or diagnosed. Increasing the awareness level of diabetic retinopathy among the patients with diabetes is a crucial factor that enables early detection and management of diabetic retinopathy. Moreover, it helps to prevent the disease from causing total visual impairment. This is just this I am showing this image just to have a, an idea that what a normal retina looks like and what are the changes which progressively develop over the retina as you go through mild to severe to proliferative changes of diabetic retinopathy in the retina. So take home message. First, get a comprehensive dilated eye examination from your ophthalmologist or retina specialist at least once a year, which is applicable to all diabetics. The second most common is early detection of retinopathy reduces the risk of blindness and it reduces the chances of developing total loss of vision and improves your quality of life. The other things that you should always consider and always follow to avoid or to control the development of diabetic retinopathy are: control your blood sugar, maintain healthy blood pressure and cholesterol levels, proper treatment for anemia and nephropathy if required, and other lifestyle modifications such as quit tobacco and smoking and exercise regularly. So these are the basic fundamentals required to avoid development of diabetic retinopathy or to prevent it from having total loss of vision. Thank you.
Thank you, Kush sir, for sharing such an insight on diabetic retinopathy.